My name's Sue Bailey. My background is as a clinical psychiatrist. I've worked with health education in other roles, and this time I was asked, and feel really privileged, to be chairing the chairs of all the 8 new role, task and finish and implementation delivery groups for HEE. And I was delighted to do it. I like doing things that are going to be challenging, and it's actually been really joyful thus far, and I think it will carry on being. So yes, I'm just enjoying having a title that says I'm the chair of chairs. Well, my background is I'm a psychiatrist, but I've always worked in teams with mental health social workers, and to me they've always been invaluable. What they always did is they understood that person in the context of their social life. And often if you were working in a hospital base, you wouldn't actually understand that, but the social worker would understand the home environment. And that was really, really important. In those days, we talk about rehabilitation, not recovery, how we could help those patients to get back into the community and live their lives well. We've had so many major changes in health and social care services, but I think throughout that time, mental health social workers have always been the holder of the human rights of the patient. They've got huge legal literacy. They understand the systems far beyond mental health legislation, child legislation, special education. They are experts in that field. They use that to safeguard and protect the patient in the best possible way. And they've got a different approach in life. And I think I've seen that it's not, even though we've had challenges, that's not diminished with mental health social workers. They think about that whole picture and how they can support families. They don't ignore carers. They bring this whole sort of picture, and then they develop their own specialist skills. I work with forensic social workers, which was a hard grind because many of their patients would be in hospital detained for years and years, and still are. They are a core, pivotal part of the total mental health workforce, and they need to be supported properly, which means whichever system's employing them, they need to have the right to access to supervision, to mentoring, to guidance. Their caseloads need to be looked at because, any health professional, any social care professional is liable to burnout. And if we're actually going to retain mental health social workers, so this isn't just about bringing more social workers in, giving them new roles, this is about retaining them, giving them career satisfaction over their life. And that takes time. I do think we've got an opportunity if we can pull all the innovation that this new roles group is bringing with it, and as we go and meet more people, the ideas they're bringing in, social workers are really good at doing something, getting it done, and then sustaining it. So it's our duty to support them emotionally. The new roles work in mental health social work. One major component will be about the AMPs, and they'll have specific training, and that is progressing, and I feel that will be successful. The other is really where social workers feel they can best flourish and develop these roles. So it could be a range of things. So it could be expanding the role of mental health social workers who choose to work in forensic services, so they take on more responsibilities. We may be looking at the role in children and young people's services. So, at the heart of mental health social work is prevention. There's a huge opportunity there. We tend to just sort of say, children who've got autism and learning disability will inevitably get mental health problems. Well, there's nothing inevitable about it. Now, if you think a mental health social worker who understands families and supporting families could be the key to unlocking other agencies to give those families and that child the help they need to get the diagnosis, to get the psychosocial support, so those children don't develop psychosis in their teenage years. Working in perinatal mental health, working in personality disorder services, because social workers know a lot more about trauma and trauma-informed care than many other professionals. They've got the tools and the understanding because they've got this sense of knowing when to offer what intervention to the person at the time they'll get maximum benefit. They know when to hold back and they know when to step in. And that's going to be the skill in this new roles. That's the actual art of what they're going to be doing. That's the art of the science, and the social workers have it.